Hi everyone, I hope everybody's doing great. Thank God the weather is getting nicer, so that's a great plus. I'm very excited to start a series, about fibroids, and I'm extremely excited that this series is going to be with Viva Eve, who I believe they're one of the experts, one of the best experts in fibroids in this country. So Dr. Gohar is going to join us really shortly. I'm waiting for him, and once he starts, we can talk about Dr. Gohar, Viva Eve, and fibroids. Fibroids. I see them every day in my office, every single day. Patients complain about them frequently. They cause a lot of discomfort. They cause a lot of pain, bleeding. They're associated with infertility, especially if they're in locations where implantation is crucial. They cause heavy bleeding. They're one of the leading causes of hysterectomy in this country, blood transfusions, admissions to the hospitals. So there's a lot of things that's going on regarding, fibroids, management, symptoms, types of them. So we're going to discuss a lot of those things. So every Thursday at 6 p.m. for the next couple of weeks, we are going to have Dr. James Gohar from Viva Eve discussing with us fibroids. So once we have him, we will start the session, and we will also take some questions for people who have questions regarding their fibroids and others. So we just want to wait a few more minutes or seconds. He should be joining us really shortly, and then we can start the process. So, okay, I actually prepared some questions for him because I'm excited as well to have a session with him. He's really an amazing guy. I like him a lot. Patients love him. I refer patients to him. It's just like they really fall in love with him as far as his bedside manners, his practice. His main office is mostly in. He started in Forest Hills, but now he expanded to Manhattan. So we're gonna tell us all these things as well. Just waiting for him to join. Okay, I see here Viva Eve joined. So once he requests us, then we can accept. We already have some questions actually about fibroids. We're gonna take all those as soon as he. Sure. So I think it's a. And fibroids with the biggest around 8 centimeters that I won't know until they're. So we're gonna discuss this question. I'm reading the questions right now. I promise I'm gonna do my best to discuss all those as soon as Dr. Gohar join us. This is another question about laparoscopic surgery. All right. View request. Dr. Gohar!
Dr. Merhi!
Thank you so much for joining us.
Thank you so much for having me.
At 6 o'clock, I made it home. I was stuck in one of the worst traffic. I don't think we shouldn't drive with this gas prices. They're going crazy.
So, I don't blame you. It is, we're paying by the mile now.
It's crazy. It's really crazy. It's really crazy. Well, thank you so much. I was saying great things about you, but now since you're here, I can't say that. I don't like to give people compliments in their face.
I appreciate that, Dr. Merhi. Look, honestly, it's an honor to be here. I have to admit to all the crowd, this is my first Instagram, and I feel very honored to be a part of it.
There you go. We're gonna bring you to the social media world. That's it.
Yes, absolutely. Happy to be here.
So I was telling everyone that we're having series of fibroid sessions every Thursday at 6 p.m. This is the first one. So we're going to try to get as many questions as possible. We already got actually questions that I would like, I promise we're going to answer them at the end. But
Sure.
Dr. James Gohar, first, I would like you to tell us a little bit about your background. I want to know more about you. The more things you tell us, if you want to share your personal stuff, happy to do that. And then I'll start from there.
Thank you, Dr. Merhi. Yes, so my name is Dr. James Gohar. I'm the co-founder and CEO of Viva Eve. I happen to be an OB/GYN as well. Did my training down in Georgia and at the Medical College of Georgia many years ago. And of course, we run a group of women's health practices here in New York City. We started originally in Forest Hills, expanded into Astoria, and now on Madison Avenue as well. I have,
this is
a great, tremendous group of colleagues.
Sorry, go ahead.
I was just describing a tremendous group of colleagues, and ultimately, of course, the stats are we are a team of 11 doctors. We just added on our 12th, and 4 nurse practitioners. We have a tremendous group of talented individuals. But ultimately, all of those individuals and all the physicians and all the brain power really just goes back to a single premise and a single mission, which is what we describe as reinventing women's healthcare. And for us, that concept, that approach, really is not just about one single process like fibroids. It's about women's health holistically. It's what we do as gynecologists, as obstetricians, as GYN surgeons, diagnostic radiologists, intervention radiologists, anesthesiologists, and now plastic surgery as well. But ultimately, as a group, as a team, our goal and our objective is to make our patients be really the best version of themselves they can be. And so beyond that, on the personal note, I am married for many, many years. I've been with my wife now for a total of about 20 years since we first met. We're college sweethearts.
Bless her. Wow. You must be
God bless her for putting up with me. I agree.
Husband. You must be a good husband, Dr. Gohar.
And I have 2 boys, and our dog we consider to be our 3rd boy. So he's been officially part of the family now for about 5 years.
Oh, that's so cute. That's really cute. So so tell us a little bit. I want to go back to you a little bit. Tell us a little bit about how you started your practice. Where did you start the practice before Viva Eve came? Because as far as I know, there was no Viva Eve. And when did Viva Eve launched? The new name. And how did you choose?
It's very true. It's very true. How did you come up with the name?
Yes. Well, tell us more about. Let's start with you first. How you started.
Happy to. Yeah, so look, the story actually goes back to the 80s. My mother was an OB/GYN, and she, I'm sure, had some influence and inspiration, I'm sure. I thought it was all driven by myself, and it was all, my own passion for medicine, which it absolutely was for the majority of my life and career. But I saw, pictures recently of myself at the age of like 3, 4 years old wearing a stethoscope and examining my grandfather, and I'm sure that idea came from somewhere. So look, at the end of the day, I was really fortunate. I had some tremendous, opportunities, and I had a wonderful role model, my mother, who happened to be an OB/GYN. She had started the practice originally, the first iteration, back in the early 80s. But then she had a bit of a health scare. She unfortunately had gotten sick. Thankfully, she's doing great now, but we didn't know it at the time. She got sick around 2010, 2009, and I was still finishing up my training at the time, so she retired. At my urging, and thankfully the family, and she listened to us, and she's doing great now. We didn't know it at the time, but ultimately the practice had closed down. Forest Hills Medical Services. Forest Hills Medical Services had been a staple in the community in Forest Hills for over 30 years at that point. Wow. And then when I completed my training, and we moved back to New York from Georgia, my co-founder, my wife, and I, we both had some thoughts, and we were thinking about like how we want to do things and what kind of environment we want to practice in. And we knew we wanted to do something different. We knew that we wanted to be in private practice. We wanted to have an opportunity to build something that would be different for our patients. And so even though I was working at the hospital, we were moonlighting, and we figured out a way to open up the practice and pretty much reinvent it and reopen it from scratch. And so we had to renovate the space. It was quite outdated. We had to borrow money that was very, very stressful for us at the time. But fortunately, we started just her and I. She was at the front desk. I was the doctor, and somehow all together we ended up building a tremendous group and following. And so, as far as to answer your question, Dr. Merhi, Viva Eve was born actually in 2016, and we thought it was a separate practice because it was a practice that was focused just on fibroids. We thought that we needed to create a different angle, a different opportunity to treat women who had a common problem that we were seeing. And then a few years in, we realized we're really confusing ourselves and our patients unnecessarily. We should all be under one banner, under one roof, under one name. And so we just combined everything under the name Viviv, which to us means, really at its essence, long live women, health to women. And I think it's very consistent with our premise of, helping women, be better and healthier and happier versions of themselves.
Well, that's really, really great story. So how does it feels to work with your wife?
It's an interesting question. Honestly, I don't even think of it. It's been so long.
You don't
It's
have to
been
answer.
so long, honestly. It may sound like a loaded question, but if you talk to her, you talk to me, we've been together for so long on so many different levels, both as friends and as colleagues and as, as partners. Fortunately, it works out. We're both very passionate. We often will have like very lively conversations and sometimes people who don't know us well, they'll think, oh my God, they're arguing. But in fact, it's just what I think brings out the best in both of us. And we both have different areas that we're strong at. So I think we complement each other pretty well.
That's amazing. So you started for Viva Eve in Forest Hills.
Yes.
Because I follow you closely and I saw your social media and the invitation. Thank you for inviting. You opened on Madison Avenue. So
yes.
Tell us a little bit about this. It's a big move. I like this move. I like, this means there's a lot of confidence in Viva Eve and the patients are really trusting in you. Because look, when I opened here and here, people thought I was crazy, which I am, but patients were asking me to do that. So I'm sure you're responding to your question, to your patients. Tell us why Madison Avenue.
Exactly, Dr. Merhi. It's so true. I mean, we noticed so many of our patients were coming to us from other parts of town, many from the city in particular. And either our patients would work in the city or they were living in the city. We were getting to a point at Forest Hills, we were just bursting at the seams. We kept on having to expand multiple times. We first started with one section of the space. It was much bigger than what we needed initially. And then we had to expand about 3-4 times over the last several years. And so at one point we said, look, there's nowhere else to go. We're running out of space. And so what do we do next? And where do we want to go? And so we realized that a lot of patients were coming from out of town. They were coming from, either, upstate New York or Brooklyn or New Jersey. And so we thought we wanted to be someplace that was central, that had a lot of public transportation, that was easy for people to get to, and that ultimately gave us a lot more opportunity to take care of more women. And so our space at Madison, we opened up now about 2 months. It's quite big. It's about 12,000 square feet. It's an entire floor. We look at the Plaza Hotel right from the corner window. So it's a really great location. We were quite fortunate in being able to get the place set up in the midst of the pandemic. And we've been way busier than we ever expected to be when we first started. So we're fortunately, I think, hitting a nerve, and I think it's been quite an experience. We feel very fortunate.
Well, that's really great. I'm very, very happy for you. I mean it from the bottom of my heart. And I went to Viva Eve Instagram and I saw the video. It's just beautiful. It's really beautiful. The colors.
Thank you so much, Dr. Merhi.
Sure
Look, what you guys have done is
sure.
absolutely beautiful as well, Dr. Merhi. I mean, I'd love to know, what your thoughts were and how you ultimately ended up, making some of the decisions that you made about your locations as well.
What's that? Sorry, I don't know.
I'd love to know what prompted you to. You recently opened up a new office, for example, in Brooklyn. I know prior you had opened up several locations within this past couple of years. It's been beautiful to watch. Why did you open up the last office in Brooklyn?
Thank you. Well, listen, I think I'm crazy, but I dream a lot and I really want to expand. My goal is to become, honestly, I'm a very competitive guy, I have to tell you. I want to become the best fertility doctor and best fertility clinic in the world.
You really are one of the best I've ever met, so I don't doubt that at all, not in a second.
I appreciate that. But look, I mean, the key is honestly finding the good team, like you said. And in the pandemic, like you said, it's really hard to find doctors or staff who has the same vision as yours and are dedicated to the patients as much as you are. But my goal is to open in California and New Jersey, which, by the way, I have 2 licenses. We just launched something today, half an hour ago, portable IVF. It's breaking news. I think this is going to be game changing for the whole IVF world. I think it's going to be the Uber of IVF. Sorry,
Yeah.
Uber, I'm not steal the name, but you can talk more about this, at more in details. But
I'd love to.
so we do have patients all over, and honestly, people think, oh, you open in Brooklyn, you expanded too fast. I respectfully disagree. I'm actually losing money by opening in Brooklyn because patients can come to the city, but I'm making it easier on my patients to monitor and do what's needed there because of the pandemic, because I didn't want them to come to the city to be exposed. So I pay rent, I pay for, look, it's nothing. To me, the convenience of the patients and making it easier for them is the key, because fertility by itself is a very stressful thing to start with, Dr.
It
Gohar. And
is. It is.
patients
And it's a
do a
very
lot.
intense process. It requires a lot of moving parts, a lot of
And I
visits. So I can appreciate it's different.
Right, exactly. So yeah, so that's the story. But you'll hear soon about new locations. So stay tuned. So so tell us a little bit about, again, I'm gonna go back to Viva E because I don't want people to think it's just fibroids. I know you mentioned briefly. Now you have plastic surgery. So tell me,
Yes.
I'm a woman, I'm pregnant. Do you deliver babies? What else do you do for me?
Yeah, so that's exactly the way we think of it. We think of it as like a holistic approach. So we have 6 different specialties now, and so nutrition also is part of it. So we deliver babies. We help people get pregnant, and of course, if it gets to the point where we need a fertility specialist, of course they all go to you, Dr. Merhi. And then once they get pregnant, we deliver their babies. One of the common problems that we of course deal with is fibroids. It's such a common issue. But there's all sorts of other conditions that can cause issues like bleeding or pain or other impacts in quality of life. So all of those GYN procedures or GYN services that would be necessary, we take care of as well. We do all of our ultrasounds in-house. We do all of our blood work in-house. And at the end of the day, it's also about the convenience for the patient. So we've learned that our patients are very busy. They they have families, they have work. There's so many components to their life that make it hard for them to bounce around from place to place to do the smallest things. And so what we try to do is we don't want to be the jack of all trades, master of none. The way we see it is we want to be able to be that comprehensive place where our patients can take care of all of their common problems within one group. And so the idea behind nutrition is that we learned that so many of our patients have, issues that would require them to make some adjustments to their diet. And we all know that a good diet, a healthy diet, and a healthy exercise regimen and good sleep are the foundations of good health. And so we thought that'd be a natural thing for us to be able to provide to our patients. Plastic surgery was really, really interesting, angle that we hadn't really thought a whole lot about before. But what we realized were, things like mommy makeovers are such a common thing nowadays. And so when patients have had, babies and they've, been busy, they get to a certain stage in life where they maybe want to, pamper themselves a little bit, and there's maybe something about their body that's bothering them or reducing their confidence. At the end of the day, the way that we think about it is whatever we do, we want to do really, really well, and we want to make sure it's complementary and ultimately a holistic experience for the patient.
That's amazing. So a common question patients ask me is, where do you deliver, which hospitals?
Sure.
Because to them,
so we actually have several affiliations. So for our deliveries, we actually use Mount Sinai. Particularly the Mount Sinai West location, but we actually have privileges at all the Mount Sinai hospitals. We also work with New York Presbyterian. I recently just added on NYU Winthrop as well as part of our hospital privileges. I was just added on as a clinical instructor on their staff, literally just this past couple of weeks. Dr. Gopal as well, my partner. Dr. Reed, he's a world-class plastic surgeon. He's got privileges at both Lenox Hill and New York Presbyterian, Cornell. He's a professor at Cornell. And so, look, I think at the end of the day, we've got all the hospitals we work with. But when it comes to deliveries especially, one of the things that we often do in OB/GYN is we try to consolidate. We try to make sure that we deliver out of one single place rather than bouncing around from 4 or 5 different places. Because, as a call group, when we cover our call, you never want to be in a situation where you have to go and deliver a baby in 2 different places. That's not a good, it's not a good formula. And so we consolidated to what we believe to be one of the top labor and delivery units in the country. And Sinai West, it's central in the city. It's on 59th Street. It's only a few blocks from the new Madison Avenue location that I'm in now. I literally can probably throw a stone if I'm feeling extra healthy on a given day to the hospital. So yeah, I think the other thing about hospitals, I'm sure it's the same thing with you, Dr. Merhi, is we use the hospitals when we need to. But as much as possible, we try to keep our patients out of the hospital. And we try to do the work that we need to do for them as long as it's medically appropriate and in an outpatient setting where they're comfortable, where they don't have to wait on long lines, where they're not getting exposed to COVID. All these factors have all interplayed over the years to create an approach where we try to keep our patients out of the hospital as much as possible.
That's amazing. That's amazing. So your plastic surgeon is gonna suck my fat from my double chin. Is that right? For free?
There's no fat, Dr. Merhi, but yes, of course, you get whatever services you want, my friend. By the way, for all of our viewers here, Dr. Merhi and I go back a long ways. We tease each other all the time. He loves to talk about his great head of hair, which clearly I was not blessed with.
That's funny. So let's talk about fibroids, since we're getting a lot of questions here, and we have a lot of stuff. I don't want to keep you all night. Tell me about fibroids. First of all, what are fibroids in general?
Yeah, look, I'm happy to. I'm actually happy to maybe even use a graphic that I think might help us make this a little bit more fun for our viewers. So let me pull this up. If you got a minute, I think it might be a nice way to answer that question in a more interesting way.
Take your time.
I'm going to move this over here, and please let me know if the camera angle isn't as favorable.
If you can, yeah, perfect. Probably a little bit up.
Yep. Okay. And I'm going to get the screen in a second. Please bear with me.
Take your time.
If it doesn't work so well, then I'll do it the old-fashioned way.
No problem.
Okay, so what I'll do is, let me do this. I'm actually going to use the screen. Here, I'll do.
Sure.
So, if we were to look at the uterus, fibroids, I'll get to in a second, but I usually like to start by talking about the menstrual cycle.
Can you explain to us first what's this photo we're looking at?
Sure. So this is of course, a graphical representation of the female reproductive system, right? So this is the vaginal canal right over here. This is the cervix. This is the uterus and the endometrial cavity inside here where pregnancy occurs. These are the tubes, and these are the ovaries. And so what I'll often answer when people ask me, what about fibroids? I usually like to start with the basics. And so the basics often for us will be, just talking about what happens with the menstrual cycle. And so the menstrual cycle to me really starts with two main hormones. Please excuse my bad handwriting. Estrogen and progesterone. Right? These hormones, as you know, Dr. Merhi, have a lot of different effects with the body. When it comes to the uterus, what they do is they stimulate the lining of the uterus. And the stimulation really happens in one primary area. And that's this area over here, what we call the endometrium. And the goal of the stimulation really is, Dr. Merhi knows well, is really for one reason only, to capture a pregnancy. If a pregnancy happens, terrific. The body will continue to feed nutrients, bring in blood supply, and take away waste products, and the pregnancy will thrive. If someone doesn't become pregnant, the signal sends shut this down, and then you bleed, and the cycle starts all over again. That's the menstrual cycle in a nutshell. Now, for some unknown reason, to answer your question, Dr. Merhi, some women develop fibroids. And these fibroids are essentially benign muscle cells that go haywire. So the uterus is made of muscle cells, and these two are muscle cells, but they go haywire, and we don't really know why. There's all sorts of theories on why. We've been studying this for years. We know it's more common in certain ethnic groups. For example, black women are 3 times more likely than other women to get this. But it happens to women of all ethnicities, of all ages in the reproductive age, and it does tend to grow in more families, or tend to occur in certain families more common than others. But once it occurs, regardless of the reason, the mechanism is almost always the same. And that is these fibroids then recruit their own blood supply. And this, Dr. Merhi, as you know, is the beginning of the problem, right? This is exactly when the problem begins. Why? Because the body doesn't know the difference. The hormones aren't designed to decipher between the blood flow that's normal, that's actually feeding the endometrium, and the abnormal blood flow that's going to these fibroids. So now the hormones and the blood flow that was designed to feed a pregnancy now is feeding these fibroids. So month after month, cycle after cycle, these fibroids grow and grow and grow. Now, one thing I often say to my patients is it's important to keep in mind is that for the vast majority of women, this is not a dangerous process. It looks scary. It doesn't look very pleasant to look at, but it's usually not life. It's not life impacting. It's not, well, it's impacting for sure, but it's not life threatening. It is not something that's dangerous. There are certain extreme circumstances where there are exceptions to that rule, where people are bleeding too much to the point where they're getting blood transfusions, they're getting admitted to the hospital, or if they're pushing on certain critical organs. But the vast majority of women usually suffer from symptoms due to these hormones and due to these fibroids really getting to this point, as opposed to anything else.
Right. So you drew fibroids in multiple locations, right? And a common question from my patients as far as fertility, and it's interesting that you drew blood vessels between the fibroids and the ovaries, because I tell my patients, before you cut your fibroid, freeze eggs or embryos, because when you remove fibroids, you lose some eggs. And they look at me like, what does this have to do with this? Because the fibroids in the uterus. But really, there's connection that was very important that you drew between the ovaries and fibroids. And what I like about you, besides that you're handsome and everything, is that you think about the patient's ovaries before you just, oh, let me take out fibroids and make surgeries and do money and build. So honestly, that's what I like about you. So tell us a little bit about the locations of the ovaries, and then we can talk more about symptoms and stuff like that.
Yeah, Dr. Merhi, I'm happy to address that. I think you bring up some great points. I think the question that you're getting at is, what other considerations does one have with the different modalities? And I think the thing is that, one thing that we take a lot of pride at Viviv is we offer all the different treatment options for fibroids. We don't really get into which one is better, which one is worse. I think that's a common problem you'll see in some unidimensional practices, where if someone only does one treatment modality, that becomes, the only modality that one should consider. And so the way we look at it is, look, there's some medications that one can use with varying degrees of success. There are side effects related to a lot of them. They're usually for short-term use. There's myomectomies where we cut fibroids out. We do those, of course. There's many different ways to do that. We can do that either abdominally or laparoscopically or robotically, and even hysteroscopically. And I'll explain the differences between those different modalities when we get to them. Of course, removing the uterus is something that some women choose to do. We like to leave that as a last resort, but it's astonishing to me whenever I read the statistics about how many women in the country have hysterectomies every year. It's just an astonishing statistic, over 500,000 every year. And lastly, the uterine fibromization, which is a terrific option that many women don't even know about. I think the latest numbers we saw is somewhere around 60% of women haven't even heard of it. And that's one of the things that we specialize in. We have a terrific world-class group of uterine fibromization specialists who are what we call intervention radiologists. But to your point, Dr. Merhi, when we do some of these treatment options, even though risk of fertility impact is relatively low, whether it be embolization or myomectomy, both have a potential risk of impacting fertility. And so one of the things one would often consider is, well, if someone is, never had kids before and they're really concerned about it, and that 1 or 2% risk is the kind of thing that's going to keep them up at night, we say, look, either we get pregnant right away and then we take care of the fibroids after, or we freeze your eggs. And I think that's a really great tool and option for some women to consider. And many women take that option.
Well, we're going to talk about treatments in different sessions, I think. We will, in details. But for today, I want you to tell me a little bit about fibroids, their location and symptoms, right? You drew, again, which one causes more pain, which one causes more bleeding, which one causes more infertility, which one causes, because I get this question also all the time.
Sure. Happy to address it. So yeah, I think, and I actually have an interesting angle to that I'd love to get your thoughts on, Dr. Merhi. But, in terms of the fibroids, I'm pulling it up again right now. There are different types of fibroids, so to speak. And I think the categories are kind of rough. They're based on anatomy. But basically, if we pull up the screen again, if one were to have a fibroid inside this T-shaped section, I think I may have pressed too many buttons there at the same time. 1 second. And so if one were to have fibroids right where that section is in the center, that's what we call an intracavitary myoma, when it's inside the cavity. I think most fertility doctors and most gynecologists agree that that's the one that has the most potential impact on fertility. And I think the real reason is because that area to us is very valuable real estate. And so if a fibroid's happening there, if it's occurring there, it's taking up space where pregnancy could otherwise occur. And so the general rule of thumb is if it's in the cavity, we don't want it in the cavity.
Right.
There's also fibroids that can occur within the muscle layer. We'll call those intramural. And that's in this section over here. If I were to draw it for you. This would be what we consider to be intramural. Whereas the previous one we talked about would be inside here. The third type is when it's on the outside and sticking out like there. That's what we call a subserosal.
Got it.
And so the question I was going to ask you, Dr. Merhi, is I've just been reading lately some of the research talking about how fibroids of any location now could potentially have some impact on fertility. Whereas in the past, we used to always say no, that was not even something that we would consider. It was only fibroids in the cavity that could impact fertility. The main reason why we treat fibroids isn't really necessarily for fertility. It's really for all the other potential symptoms that you'd ask me, and I'm happy to elaborate on further.
Yeah, look, I mean, fibroids, similar to endometriosis and other things, they are correlated with a lot of, other pathologies in the lining of the cavity of the uterus, especially implantation. So fibroids, as far as I know, if it's in the cavity, like you said, it lowers implantation, it shouldn't be there, number one. Similarly, endometriosis causes lower stickiness of the lining. But similar to what endometriosis does, there are studies showing that if someone is more predisposed to develop fibroids, they might have less of that natural glue in their lining that could potentially lower their implantation rate. It's still not, it's not something I would say it's final, because as you know, a study is different than recommendation and guidelines.
Yeah, we're always learning. Yeah.
Exactly.
Yeah.
So, but thank you for describing the location of the fibroids. As far as, bless you.
Thank you.
As far as symptoms, first of all, if you have to guess, what percentage of African women have fibroids? What percentage of Caucasian white women or Hispanics have fibroids? If you can guess.
So I don't know by ethnicity, but what I can tell you across the board, the numbers are quite staggering. So by the age of 35, 30% of women will have fibroids. By the age of 50, that number goes all the way up to 70 to 80%. It's quite remarkable. And that's of all ethnicities. And now when you think about the fact that black women are 3 times more likely to have fibroids than non-black women, that's a remarkable stat. But I think it's important also to keep in mind that only a third, only 30% or so of that group will actually end up having symptoms. So one of the things we often say to our patients at VV is, look, not all fibroids need to be treated. Not just because you have a fibroid do we need to treat it. Sometimes we can just manage it conservatively. Sometimes we can watch it. Sometimes we'll need to treat it with medication. Sometimes we'll need to use different treatment options. And so I think the main deciphering characteristic that will cause us to treat usually goes back to symptoms. Because for us, symptoms are about quality of life. And those can be about 1 out of 6 potential symptoms. One is heavy bleeding, heavy cycles. Second is painful cycles. The third is pressure symptoms or bloating. Fourth would be pain with sex. The fifth would be urinary symptoms. And the last would be some sort of pelvic or back pain that occurs even outside of the cycle. And those are the symptoms. And so some people are very unlucky and they have like all 5 or 6. And other people, they hardly even notice the fibroids are there. And so similar to endometriosis, it's an interesting point you bring up, Dr. Merhi. You know as well as I do, we've all seen cases of endometriosis in the OR that look like, for lack of a more gentle way of describing it, but it looks like, a really bad thing occurred. Like, an accident happened. Like, there's a lot of visible disease all throughout the pelvis.
Right.
And then you examine the patient, you talk to them, and they hardly even notice their symptoms. It's not bothering them at all. And then you have other patients that only have like barely identifiable areas that you have to really look for in the surgical suite. And only once we confirm with biopsy, which is the only way to confirm and diagnose endometriosis, in a definitive manner, then do we know that that person has endometriosis. And so fibroids, and their symptoms are horrible, by the way, right? So fibroids are very similar in that respect. We have patients that come to us with fibroids the size of, large melons that they hardly even notice that are there, and they're taking care of them because, it's impacting, fertility, or it's because it's pushing on other organs. Whereas we have other patients with tiny fibroids you hardly even notice, but it's driving them crazy. And when we treat them, it is like a night and day difference in their quality of life.
So if you're talking about quality of life, let's say I don't want to have surgery, right? I don't want to treat my fibroid. Is there anything I can do at home to lower the symptoms of my fibroids to make them shrink?
It's a great question. I get that quite often, and I always want to, preface by saying that there's always things that we know and things that we don't know. And so I have patients who come to me who are doing herbal detoxes, and I have patients of mine who are drinking, some exotic tea, and who have read something about some supplement somewhere, and they're trying some new diet with some new supplement. I'll say, look, if something works for a patient and they feel like it makes them better, and it's not causing them harm or causing harm to any of their loved ones, then I think, okay, whatever works, as long as it doesn't cause them harm. But from a scientific standpoint, from a medical standpoint, we don't really know of a whole lot on those levels. We do know that, for example, magnesium can be helpful. We know vitamin D might help a little bit. But is it going to solve someone's fibroids? Is it going to make a mechanical problem just disappear? Not that we know. We haven't seen any studies that support that. I think one thing that can be a little dangerous that we do see sometimes is when patients use certain herbal supplements or hormonal supplements that are often based on soy or based on estrogens. And often what will happen is they'll take medicine similar to like when people are in menopause that people say is natural, but in fact is hormone based. And so what that does in the case of fibroids, you have to keep in mind that drawing that we had before with the estrogen and the progesterone, the hormones can feed the fibroids. And so, you can often make the symptoms better and cover up the symptoms for a period of time, and then only later realize that your fibroids are as much of a problem as they actually are. And so I don't know, Dr. Merhi, do you know of anything that,
The most, and I know Dr. Ayman Al-Hindi, who is at University of Chicago, one colleague of mine. He studied fibroids and a lot of NIH grants and funding. He's a very smart guy. He specifically studies fibroids in African American, and what he did, he found a correlation between low vitamin D and size of fibroids and developing fibroids. Vitamin D is actually an anti-cancerous medication, believe it or not. It's like a steroid. It's like an estrogen, like progesterone, structure-wise. So when they replace them with vitamin D, some of those fibroids actually cooled down and had less symptoms. So the vitamin D is important. However, we have to be also very careful is how much vitamin D is enough for African-American women. I'm talking about that because most of those studies were done in African-American women by Dr. Hindi, as far as I know. How much vitamin D, what the level in the blood needs to be done? Is it the normal level is more than 30?
That's great. You bring up some fascinating points. And I think, I hate to interject, but I think the reason why it makes so much sense and it's worth really exploring is because, as you know, vitamin D, it's a building block for cholesterol. And ultimately, people think about cholesterol as a negative thing, as a bad thing, but like you said, it's a steroid. In many ways, it's a building block for these hormones. And vitamin D, as you know, like the best form of vitamin D in the world is sunlight, right? And so it makes sense that women who maybe have a little bit more melanin in their skin won't be able to absorb as much sunlight as other women. And that may be a correlation that one should try to address a little bit. So I think it makes sense. Vitamin D, as you know, is actually quite a controversial topic. There was a time in medicine back in the 80s and 90s where everyone was getting vitamin D supplemented. And it seems like the pendulum has swung back a little bit away from that. But at least in this situation, it seems like it's something that is worth, certainly considering. I think I read something about magnesium as well. And so I think these are small steps that one could take that hopefully could help improve things a little bit. But it's I don't know of any other natural approaches that that solve this problem. Do you?
Yeah, no, I don't. Honestly, I don't. Besides this, and besides avoiding eating things that have high estrogen, soy based, and all that, because estrogen is what actually increases the fibroids and causes more symptoms. Now,
Yeah.
two questions I want to ask you. One is fibroid genetics? And I get this all the time. If my mom has fibroid, do I need to have, does it mean I'm going to have fibroids? I do know the answer, but I want to know if, I want to see if, since you're the experts, and honestly, I'm not reading about fibroids every day, but you are. Is there any recent study showing that it's genetic like that?
It's a great question, Dr. Merhi. I think we've been asking this question for many, many years, and I'd love to know if you've read something recently that I haven't. I think, historically, we've often said, look, we definitely see a correlation. There's no question. There must be a correlation because it's too much of a coincidence to be a coincidence. We see families with mothers and aunts and sisters who have fibroids, but historically, we've never actually quite found the gene. So we know it's more common in certain ethnic groups. We know it's more common in certain families. Have you read something about them finding the specific area where fibroids are passed on?
Not really. I agree with what you said. And I think somebody mentioned as to why we haven't figured out treatment for fibroids or the source of fibroid. I can say this to our viewers is that similar to diabetes and hypertension, there is no single gene. There is genetic factor and there's environmental factors that all interact together in order to cause fibroids. So I wish there's one gene like cystic fibrosis, then I can look for that gene, but it's not like this. It's multifactorial. And that's why the NIH, the government spends millions of dollars to study fibroids because they don't want to pay for people's hospitalizations and hysterectomies and blood transfusions. So it's in their interest to treat fibroids and find a treatment. And finding the root of the fibroid is the key to treating them. But as of now, as far as I know, and I know a lot of scientists who are doing fibroid, I'm not aware of any gene in particular that's main one that's playing a role in developing fibroid. My second question to you is, can they turn into cancer because they're tumor?
It's a very common question as well. And look, the short answer is yes, but extremely rarely. It's not really the fibroids turning into cancer as much as them being misdiagnosed in a very small subset of people. There are, for example, one thing that we do in our group, when someone's got fibroids, there's a process that they go through. And one of those is always cancer screening to ensure that the most common form of cancers are all excluded from being a possibility. And that's not necessarily a cancer of the fibroid as much as these are other causes of bleeding and other causes of the symptoms that can be misunderstood to be fibroids. And so we'll always check, for example, a pap smear to make sure the cervix is okay. We'll also always check the lining of the uterus through doing a procedure called the hysteroscopy, where we take a camera and we go from below and we look at the lining of the uterus. We do a gentle cleaning of that lining, that same tissue that ends up in a pad or a tampon. We instead collect that into a specimen cup, send that specimen cup off to a lab. In the lab, there's doctors like myself and Dr. Merhi who look under microscopes all day. We call them pathologists. And they'll come back and say, yep, all these cells are good. And they give us peace of mind. But I think what Dr. Merhi is referring to isn't necessarily the workup and the things that people can often confuse with fibroids or confuse, when in fact they have other causes for these symptoms. But there's, other rare types of cancers called leiomyosarcomas, which are quite rare. And there's usually very specific characteristics we look for, both in terms of history, clinical presentation, and imaging that make that, certainly a diagnosis that we need to catch. But fortunately, it's quite rare. We're talking about less than 3 or 4 people out of 1,000. But at the end of the day, when you do a lot of these, you see a lot of women from all parts of the country. At the end of the day, we always have to keep that in mind. But thankfully, tumor is the short answer. Even though people often are so many of us are accustomed to thinking of tumors as being cancerous. they have two main divisions. There are benign tumors, and then there are malignant tumors. Those are the main classifications. There's more, gray there, but I don't want to confuse the topic.
Right. So thank you for
Fibroids are benign tumors 99.99% of the time. So fibroids are not cancerous, with very few exceptions, very rare exceptions. Fibroids, again, are more about the symptoms and problems they cause to people and the impact they have on people's quality of life, rather than anything that causes a great danger to health.
Right, right. Now, well, for next sessions, we're going to talk more about imaging, when to do MRI, ultrasound, treatment options, invasive, non-invasive, embolization, all that. So, but let's take a couple of questions from the viewers. Is that okay?
I'd be happy to. Yeah.
Someone is asking. We're going to go through them really quickly because I promise we're going to answer as much as possible. Someone is asking, I want to ask a question. So, but I'm going through a robotic myomectomy laparoscopy surgery on May 20 for 20 mural fibroid, and I'm 43, never has kids. I want to know, what should I do? What would you say?
I think the first question is, what is the objective? Is the objective pregnancy? Is that number one? Or is it treating fibroid symptoms? And let's
say she has symptoms and they told her, we're not take out your fibroids. She wants to have kids in the future. Now she's 43. Do you recommend she freeze eggs first? Do you recommend?
Yeah, look, honestly, I think again, if the goal is pregnancy, and that's why I decipher between the two. If the goal is just fibroid symptoms, then we could talk about that. If the goal is pregnancy, and we're 43, the single most important thing we want to do right now is improve your opportunity for pregnancy. And the biggest factor in your pregnancy is not going to be what the modality is of treating those fibroids. It's going to be the egg quality. And every year that passes, every month that passes, it's super unfair. And Dr. Merhi, I'm sure, has these conversations all the time. The whole world has evolved, right? We've got all this great technology. We all study to a much later time in our lives and work a lot more than our ancestors did. And even though everything has evolved around us, our biology is still the same. And so, I'm 44. If I lived, 200 years ago, I'd probably be one of the older people in town. Because everyone had various reasons that they may not have made it past that age, because either they stubbed their toe and there's no antibiotic, or they had some sort of accident, or there was no opportunity for people to be able to live long, healthy lives the way we do today. But the one thing that hasn't changed is our biology. And so egg quality begins to really diminish, and I'm going to defer to Dr. Merhi here. To me, what I've often counsel my patients is 37 is really when the significant drop off begins. But I'm curious, Dr. Merhi, what age do you usually find the biggest drop off in fertility for most women?
Look, everybody's different. I think the drop off in fertility is increasing significantly at even younger ages. I do believe, and I know, and there is studies that the environment and whatever we're eating and drinking and radiation and cell phones and sanitizers, it's all affecting negatively our fertility. And that's why more couple in the United States and all over the world are having infertility problems. It used to be out of 12 couple in the United States, one will have infertility. Now out of 8, they won't have infertility. So what I say to the person who asked the question, you should consider freeze your eggs before you do any myomectomy, in my opinion, because if you remove your fibroids and they cut vessels between the ovaries and the fibroids, you're going to lose a lot of your ovarian reserve. And if you want to have kids in the future, if you have those and you, God forbid, you go through early menopause because of the surgery, I'm not saying it causes early menopause directly in every person, but if it happens, you want to avoid that. Another question
Dr. Merhi, I think I saw the viewer. If it's the same viewer, if it's not, I'm sorry. If I'm mistaken, please correct me. But I think I saw the same viewer right in the chat as we were speaking, talking about how she didn't have the funds for freezing her eggs, and she still was hoping for pregnancy. But look, funds and financial stuff isn't my expertise. But what I would say, and again, Dr. Merhi can probably address this better than I can, is people often sometimes connect the expense of egg freezing with the expense of IVF. Those are two very different things. And again, Dr. Merhi, I'll defer to him on this. Freezing eggs is a much lower barrier and a much lower cost than doing the full IVF. And I think what I would often counsel my patients is, look, in many ways, that's a form of insurance in a situation where you feel like there's significantly increased risk for you losing your opportunity to get pregnant. So when we're 43, what I would say is, look, we've already gotten to a point where the chance of conceiving naturally is quite low. And when you talk about any of these procedures, many of them make tons of sense. I think robotic myomectomy, we do robotic myomectomies all the time as part of our group, but any type of myomectomy will involve us having to make sure that you cannot get pregnant for at least 6 months after, even if you recover quickly. Even if the recovery is not an issue, we're going to say, look, that uterus needs to heal for 6 months. Now, you talk about the difference between 43 and 43 and a half. That can be the difference between us being able to harvest eggs and not. And so sometimes what we'll say in that situation is, look, at least, freeze the eggs so you have that as an insurance policy. And if you don't need them, you don't need them. Great. You can, donate them or give them away at some point. That becomes less of an issue. But if you're really aiming at pregnancy, I often caution my patients, look, if the aim is pregnancy, let's not treat fibroids first. Let's focus on the pregnancy. If the goal is treating your fibroids because you're really having a hard time with your symptoms, and pregnancy is a nice to have, you'd like to have it, you'd like to retain the option, no problem. And our patients can make informed decisions once they know the pluses and minuses of all these different paths.
Got it. Now, another question, we can answer them briefly. I don't want to keep you too long, and I'm getting really hungry.
You and me both.
I had surgery for fibroid removing 3 months ago, but my cycle still has not been regular. What could be the reason? I'm 37 years old. 2 words. What do you think the reason?
Not regular. So I guess the first question I want to ask is, were the cycles regular prior? Were they regular and predictable? I think maybe what you may be alluding to, and I'm not sure, but let me just surmise. If you're saying that my symptoms have not improved, then I think we want to make sure that we've first given enough time to recover, but then we want to do some additional imaging. Maybe take a look with an ultrasound. It's not uncommon for us to get to some fibroids, but not others. Sometimes we don't get to some fibroids when we do a myomectomy on purpose because they can actually interfere with fertility or interfere with someone's health. There's often other modalities as well one can consider. One of the challenges with myomectomies, if that's what you did, because I think that's what I understood by removal, is that the fibroids tend to grow back with that particular treatment option. And so one thing to always worry about is recurrence, but 3 months seems to be a little bit too soon of a time for fibroid to grow back.
Perfect. So
I'd also check your hormones, by the way, because there are a lot of other causes for bleeding besides just fibroids.
Great, thank you for the answer. Now, someone's asking, and I saw it earlier, can antidepressants, do you know have any relationship between antidepressants and fibroids?
Not that I know of. I don't know if you've read something different, Dr. Merhi, but I've never seen a relationship between the two, well documented, well studied. Is the question or concern that by taking antidepressants that you now would be more likely to have fibroids? Is that the question?
Well, they're asking, that person, if I remember correctly, that noticed that her fibroids grew after she started those medication. It's interesting. I'm not aware of any studies either. It's something to look at because let me tell you, with the pandemic, we're all on some type of medication for anxiety, depression, whatever it is, OCD. I have OCD. So, it's actually a very important question. I'm actually curious now, so I'm going to look it up after we finish.
Yeah, it's very interesting. Very interesting. I think the one challenge with fibroids is that they are naturally slowly progressive. So one analogy I often use with my patients, it's the pot of boiling water and the frog. I don't know if anyone's heard that analogy. It's a horrible analogy and one that I hate to think about. I don't know who would be sadistic enough to do this, but apparently if you take a frog and you put them in a pot of boiling water, they jump right out. If you put them in a pot of regular room temperature water, you put the stove on, they don't know what's going on until it's too late. And
right.
The reason why I bring up this analogy, of course, our nervous system is very different than frogs, but the reason why I bring it up is to say our bodies are remarkable at being able to compensate when things happen slowly over many years.
Right.
And so when things are gradual, the body will adjust. It'll adjust. It'll adjust. You see this with patients with anemia. I have patients of mine who walk around with anemia at levels, hemoglobin levels, that if Dr. Merhi or I had, we would fall instantly and we would pass out, or we would have something even worse happen to us because our bodies wouldn't be able to function. But when someone loses just a little bit more blood every month, they get a little bit more pain every month, their cycles get just a little bit longer, and it happens over many, many years. People sometimes wake up, 5-10 years later, like, how did I get here? How did things get so bad? And so often once we correct that problem, the difference can be quite dramatic. And that's really, I guess at the end from our perspective, where we know that we've hopefully helped someone and fixed their problem.
Well, I think we're going to end this. Dr. Gohar, Viva Eve, thank you so much for your time. I really appreciate it. You know, we're going to, again, continue this next Thursday at 6 p.m. and the following Thursday, if I remember correctly. We're going to talk more about modalities of, imaging, treatment, more details about fibroids and the latest treatments, such stuff that you do that's are really novel, in my opinion. Because we have a lot
Dr.
of
Merhi, I thank you so much. It's been a pleasure. I really, really appreciate the opportunity to speak with you and your viewers. It's really been a lot of fun. I really look forward to the next one.
Thank you. So if someone wants to reach out to you to ask questions, have consultation, they have
Yes,
fibroids.
please. Yeah, I mean, like our group is at
the-
Viva Eve, vivaeve.com. So that's VIVA, so Viva Eve, just like the name, EVE.com. Our phone number is 212-988-2111. And of course, we're on Instagram, we're on Facebook. We'd love to have anyone come and visit us in Madison, here at our office in Manhattan or in Forest Hills anytime. We'd be happy to have them.
They have nice coffee machines. I saw them on Instagram, so I might go just for the coffee.
Absolutely. We have a whole tea bar with all sorts of exotic teas.
Your wife who chose the decor, not you. That's for sure.
Yeah, that's not my area of strength. That's not my area of expertise. I'll defer to our team on that as well.
Well, Dr. Gohar, thank you so much. I'll see you next Thursday at 6 p.m. And
so, by the way, I'm just getting a request here to download this video. I think Catherine was reminding me. I'm not sure what that means exactly. Please articulate or clarify.
Not at all not to know Instagram. I'm gonna make you use Instagram more.
I will. I'm happy to join the Instagram world.
So no, I'm gonna save this video on my Instagram, and then you guys can, I think, take it from there.
Sounds great, Dr. Merhi. Thank you again.
Thank you, Dr. Gohar. Have a great evening.
You as well. Take care, everybody. Have a wonderful night.